Did you know that Jamaica provide free health care? Of course it does. But because of overcrowding and understaffing, it has received a bad reputation over the years. But let's take a really deep look at it and see whether it serves the public or it's something that really works for you. Hi there, my name is Claudette and I am your Jamaican Gypsy Granny. If you're new to the channel, welcome. And if you've been here before, welcome back. Now, I started this channel initially to share my travels across the world, but when that got turned over by my being turned back from Cancun, I decided, why not talk about Jamaica instead? So, here we are. On this channel, we explore everything Jamaican. We talk about healthcare. Right now, I'm doing a series on moving back to Jamaica. I'll take you to Port Royal. I'll take you to Duns River. I'll take you to different places. So if that's something that interests you, please stick around and watch this video. Also, go ahead and leave a comment if there's something you'd like to know or hear me talk about. Just tell me in the comments. Anyway, let's get into the video. Oh, by the way, I forgot to tell you, I have now launched the Jamaican Gypsy Granny relocation services. So if that's something that you would like help with, moving back to Jamaica, navigating papers, even if you're not moving back and there's something you'd like me to help you out with, just hit me up, give me a DM, and I will certainly help you with that. So let's get into the video. All right. So today's video is about healthcare in Jamaica, as I'm guessing you have noticed, and it has received a bad reputation because a lot of you in here, especially one viewer who said that this is one of her major concerns why she would move back to Jamaica is the healthcare in Jamaica. But let's face it, healthcare in Jamaica has its stigma and all of that. But then again, doesn't healthcare offer bad situations in other countries? I mean, come on now. You've heard of stories of people going into the hospital and things not going the way it should. All right? So let's not just dig down on Jamaica by itself. Let me tell you about my experience. Now, the first one I want to talk to you about, because this one is really significant. I remember when my appendix ruptured inside me. I didn't know what it was. At that time, I was like in my 20s, going out partying and stuff. I had spent a weekend in Ocho Rios. I was, drinking, whatever. And I started throwing up. So I assumed that was from me consuming too much alcoholic beverage. And I came back to Kingston, but the pain started and I was vomiting until eventually my mom said to me, I tend to speak too fast, so let me slow this down a bit. My mom said to me, this is not looking too good. Maybe you should go to the hospital. So I jumped in a cab. I went to the University Hospital of the West Indies. And, I was sitting in the reception area trying to get registered to be seen by the doctor. But I was just vomiting. And, God bless that porter, wherever he is now. He came over and he said, miss, you're not looking too good. Let me carry you into the doctor. So he took me, no registration, no nothing. He took me straight in to see the doctor. And when they saw me and they examined me, they said, listen, you have a ruptured appendix. They intubated me right there and then. I was just swearing up all over the place. And I was literally, I don't know if any of you have seen a TikTok video where they're running to the ward or wherever with patients. That happened to me. They literally had to run with me to the theater, or as they said, 5 minutes more, 10 minutes more, I would have been a dead body outside there in front of UWI Reception Center. Okay, that is one of my experience. I can't tell you all of them, but I've been in and out of public hospitals. I've been to private doctors, and I can tell you that this service here is available for those who can't afford it and for those who can and prefer private health centers. Now let me go into the rest of the video, because if I was to tell you all my experiences, this would be the whole story. Okay, let's move on. All right, so as I said before, Jamaican healthcare system, you have both the private sector and the public sector. There are places we have private clinics. We have public clinics in almost every, well, not in almost, in every parish. You will find a public health center, one, some have two, sometimes three, four, but there will always be a public health clinic you can go to. If the situation cannot be dealt with at that level, they will probably recommend you to the hospital in the parish or community where you live. And this is true of every single parish in Jamaica. There is a hospital and there are clinics that you go to in the first instance for, you know, things that are not that serious, and then you go into they recommend you to the hospitals. All right, so this is how it works here. You have the clinic and then you go. They also, well, for university, which is in Kingston, it started out as a public hospital, but I think they did some upgrades. Now you will have to pay, but it won't cost you as much as if you go to a private facility. At the university hospital, they will charge you for bedding, they will charge you for certain procedures and stuff, and they will not admit you unless you make some sort of payment, because what used to happen is people would go there and not make the minimum payments that they were required to, and so to offset some of the costs, you will have to make a deposit before you are seen. But, you know, that is it. You can go to the Kingston Public Hospital and get everything for free. You can go to the clinics. There's a chest hospital. There are options all over Jamaica for you to go and get health care. All right? Now, the major drawback with the public healthcare system is that you actually have to sit and wait, because it's free. There are a lot of people who will be attending these clinics, so of course you won't be sped through the system. And trust me, I've been to private doctors where you sit down and wait longer than you would expect in a private facility anyway, but it would never be the same as in a public hospital, right? So you have to be prepared to wait. Charge up your phone. If you read, carry a book and be prepared to wait, because guess what? A lot of us, even though you have to spend the time there, even if we were to work that day, we couldn't afford to pay the private health care. So guess what? Be prepared to wait. That's a cost you pay for getting free health care in Jamaica. Okay, so now let's take a look at private care. It will cost you something, and there are affordable options. So first, let's take a look. If you're going to go to a general practitioner, that usually will come anywhere between $3,000 to $7,500. I mean, you will find doctors who are on the lower end of the scale for costs and those who are at the higher end. But you can usually find someone that you can, you know, fit into your budget. For a specialist visit, such as a cardiologist or anything like that, you're looking at anywhere from $8,000 to $15,000. Lab tests usually run anywhere from $3,000 to $10,000 and upwards, and imaging will vary by facility. A hospital stay, the accommodations are separate from all the other lab fees and stuff, and they are often billed separately. As I mentioned earlier, the University Hospital of the West Indies does charge you for accommodation, but it is far less than you would pay if you were going to a private facility. Now, one of the ways one of the ways you can offput the cost of private healthcare here is to make sure you have insurance that is valid and accepted. So before you leave whichever country you're moving here from, take a look, ask your provider whether their insurance would be accepted here in Jamaica to cover your costs. If they're not, you may need to look at finding another provider over there, or choosing to come here and find a provider that can fit within your budgeting needs. All right. Now, also, one of the things that Jamaica does is that they do offer for older persons the National Health Fund and the Jamaica Drug whatever. I don't know what JADEP means. I need to look that up. How bad of me. But JADEP offsets the costs of medications for conditions like diabetes or hypertension. You're usually, in order to get on this, you need to have a doctor recommend you, and you fill out your forms, you go, you present your card, and some medication may be absolutely free. Some of them will be way less. I mean, I know someone whose medication for eye drops for his eyes for glaucoma went from $10,000 down to $2,000. All right. Okay, additional to that, if you do make a visit to the clinic and you're prescribed medication, most of these facilities, I'm not going to say all because I don't want to speak out of turn, but most of these facilities have a pharmacy attached that will offer you the medication for free. This is also true of the the hospitals. I think at the public hospital, which is free, you do have a pharmacy that you can get your medication from free of cost. Also, I forgot to mention that we have a whole children hospital. Imagine that the children hospital on Tom Redcam Road is free for children, and you have free clinics where you can be seen by the doctor and then you're released, or if you need to stay in the hospital, you can stay there for free as children. So see what I'm saying? Jamaica medical care get a bad rap everywhere, but the truth is that we have free services that can serve the public. We have private healthcare that you can choose to use. The reality is that, like everywhere else, the healthcare has its problems, but it does serve a good purpose, and we are always working to develop it as a small country. So if this is what is holding you back from coming back to Jamaica, I advise you to just come here and take a look at the system and see if it could work for you, because it really is not as bad as it seems. So here's my advice to you. If you decide to come here, choose your location with healthcare in mind. Kingston or Montego Bay offer more private options, but you will be able to access healthcare in whichever parish you are at. Register with a local doctor early. Even if you use private care, having a trusted doctor is helpful. Know where your nearest clinic and hospital is, especially for when you're in a smaller town, and always remember to have copies of your medical records, especially if you have a chronic condition. Okay, these small actions, if you put them in place, it will make your transition easier. All right, at the end of it all, healthcare in Jamaica, it isn't perfect, but you can manage it if you plan ahead and you put resources in place and have realistic expectations. Just plan ahead, and it will give you the confidence and peace of mind to know that when you come here, you will be taken care of. If you're planning to go private, find a private doctor. If this was helpful, please give it a like, share, comment on it, and tell me what you've learned. And if you know someone who is considering the move, please help them by forwarding it to them. Drop your questions in the comments. I read everyone and answer to everyone. Don't forget to subscribe, hit the notification bell so you don't miss the next tip in the series of moving to Jamaica. And if you stick around, we're going to Port Royal next. Keep watching for that video. Thanks for watching. I'll see you in the next post. My name is Claudette, and I am your Jamaican Gypsy Granny. Ciao.